September 23rd, 2025, we're broadcasting live spine surgery from Duke Spine Institute. Our patient travels here all the way from Ohio. We've had a patient from California, actually from Chile through California today. We had a patient from Louisiana and a patient from Ohio and a patient from Florida who's actually from Italy, lives in Florida. So busy taking care of people from all over the world. This young lady has back pain from 2 discs, 2 piriformis, and the left SI joint. We're going to start by fixing the 2 discs. Little numbing medicine going in. She is on her belly, facing down. She's getting propofol anesthesia, which is twilight anesthesia, as most of you understand it. And this surgery will take me about 40 minutes to do the 2 discs. Then we're going to end the stream and shot. We're going to do the SI joint and the 2 piriformises. All right, if you have questions, feel free to ask. Type up your questions, and Henry will relay them to me. Sean? All right, so let's get started. How's she doing? Sean? There's a lot of light in my eyes. Shot? Too much on my hand in the x-ray. Shot?
That's okay.
Shot?
Thank you.
Shot? Hold on. Shot? Is that it? Give me an AP. L5-S1 is collapsed. There's a spondylolisthesis, grade 1. You can see there's a grade 2 listhesis at L4-5. She has osteopenia. Long story short, we have to get in there and fix these 2 discs. Very difficult to do because of her anatomy. She does have a posterior spine, which is helpful. Shot. 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 Very nice. Shot. AP. We're going to use X-ray guidance, front, back, side, side. Images to guide the placement of the needle. You can see there's some scoliosis, and I already showed you the listhesis. It's looking good. Shot. That's the L5-S1. Shot. So far, so good. She's doing fantastic. I've just got to get into this 5-1. Shot, AP, looking good. Incision. I'm going to make a small incision so that we can place the next needle for L4-5. Shot, lateral. Any questions, feel free to type them up. Because she has 5 specific pain sources, I'm going to take you all through a little video that shows the 30 most common causes of back pain, the 30 causes of chronic back pain. Of them that we know about today. I'm Dr. R. Dugmajian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Shot. All right, welcome back. We have accessed both discs, L4-5, L5-S1, through the left foramen, and the patient told us that the L4-5 was a 9 out of 10. We couldn't test the L5-S1. Now she's awake. Got to work on our timing. L4-5, as you can see, has a listhesis or slippage. Spondylolisthesis is something that most surgeons show the patient, then tell them they have to have a fusion. It is absolutely untrue. You do not need a fusion with a spondylolisthesis. We have cured hundreds upon hundreds of patients' back pain, leg symptoms with laser surgery, no fusion, they have spondylolisthesis. Berndes, we got to get this right. All right, let's show the audience how a disc injury causes so much pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Great. You see now how inflammation in the posterior tear from the herniation is the cause of back pain from the disc. Let's show you how we fix it.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Any questions?
At this moment, no current questions.
All right. So while I'm using the laser to clean up this herniation, why don't you show the audience why the Duke laser disc repair is the best treatment available? Hi, I'm Dr. Duke Majan. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Very, very hard. We're talking about this piece of herniation here. We are at L4-5. This herniation is very firm. It does not come out easily with the laser. The laser is typically more easy to remove softer herniations, but the ones that are very scarred it's still very effective, but it doesn't remove it as quickly. And what we're seeing here is a very, very scarred up piece of herniation. A lot of collagen. Everything okay? All right. Not uncommon when we get herniations that have been here for a long time, years. If I had to guess, I'd say this one's, 10 to 30 years old. Got it? But we are getting it out. It's just a little bit at a time. And you can see we're making progress. What we have here is a lot of scar tissue, which is collagen, elastin. We have a lot of osteophyte, a lot of calcification. And that makes this thing hard. So when it hits the nerve root, which is right behind it, like literally touching it, the nerve root just gets crushed by the herniation. Not supposed to be herniation next to the nerve root. Remember, nerve roots are delicate. If you've ever had uncooked soft tofu, it's just like uncooked soft tofu. Very, very, very delicate, very easy to tear and damage the nerve root if you crush it. And that's what these kind of hard herniations do. They crush the nerve roots. Right there, you guys see that?
Yes, we do.
The gold color is calcium, so that's hard. It's hard as a rock. The laser can remove it. Because we're working near nerves, we have to be very delicate. It's another advantage the laser has over other tools. That fiber is 1 millimeter wide. That's how small it is. Look at all that bone spur and calcified disc herniation. I'm going to put my grabber in and try to remove more of this stuff.
We just got a question
Sure.
coming from Mike on YouTube asking, Dr. Duke, did this patient have any numbness or leg/foot weakness? Thank you.
They did, yeah. They had leg weakness, numbness. Yep, they had definitely had signs of pinched nerves on exam. And they complained about symptoms of pinched nerves. Look at that bone spur right there. God. Of all the surgeries I do, this type of disc herniation is the biggest, what I call PETA, or pain in the ass. It's got little pieces of fluffiness that just block your view and don't want to come out. It's got very hard disc material that takes forever for the laser to get rid of it. It's just a nightmare to deal with. We never know who's going to have it. Otherwise, I might decide not to do these surgeries. Just kidding. Because they're such a pain in the ass to do. But that said, we take the good with the bad in life. Some are good, easy, some are difficult. Come on. Look at this thing, doesn't want to come out. It will not get grabbed. Just wants to block my view. Laser. All right, we're gonna be done here at L4-5 soon. We're gonna move on to L5-S1. Now remember, she has more than 2 bad discs causing back pain and leg symptoms. She also has piriformis syndrome on both sides. Why don't we show the audience what piriformis syndrome is?
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. Since you've been gone, we've been having a little fun with some surgical instruments. Let's grab Zilla.
Next one, please.
Because her disc is so hard, I'm having to get in here and use a tool that is able to remove some of the harder pieces of herniation that are difficult for the smaller tools to remove. People always ask me if the Duke laser disc repair doesn't work, can I have a fusion done? And I say sure, but we've never had that happen. So you're not going to need a fusion done. All right, there we go. We're out. And there it is. Good. Looks good.
Go on, please. Thank you.
So we never get 100% of the disc. We always get 50, 60%, which is all we need. There is no surgery in the world that will get 100% of the herniation. Come on in. Our best I think I've ever gotten is probably 90. And that's rare. We're not ready yet. All right, I guess we can try that. Go ahead. Is that it? All right. So at 5-1, it's so collapsed. What I've done is I've gotten the needle placed right at the back of the disc, but I didn't go into the disc. I couldn't get in because of the angle and the fact that she was awake, kind of fighting me, if you will. Relax. Shot. So now I'm going to bring my dilator down to 5-1 shot. And we're going to try to get in. Now that she's deep asleep, it should be a little bit easier. Nope. Shot. Good. So I've gotten, hold on, gotten everything. Let me see. Shot. About as perfectly positioned as I can. Go ahead. And now we're going to shot. We're going to place this. Yep, there we go. Good, good. We're going into the 5-1 disc space. Just about done. All right, let's bring in the scope. The surgery you're watching is state-of-the-art, most advanced spine surgery in the world to treat a herniated disc or degenerated disc. It's done without metal or implants, done without biologics, done without hospitalization, and we have very minimal bleeding. We usually lose about 20 drops of blood per surgery. Here we are inside L5-S1. There's not much disc here, not much herniation here. But you can see how inflamed it is. The amount of inflammation is pretty substantial. That's the end plate. Look how pink it is. That's because of what's called discitis. Discitis is probably the most painful condition in guys.
You want to try a different machine?
No, I really don't. I want this machine to work. Gosh, a lot of grunginess. There's some bone spur. You can see how nice the laser removes bone spur. That's what all that white stuff is. All right. Really not much for this disc. So we're just about done. Any questions?
At this
Henry?
moment, no current questions.
Good. The audience knows everything.
They do. That they do.
All right. Very good. Grab her. We're going to end the stream in a moment. We're going to move on to the SI joint. Any questions?
At this moment, no current questions.
So the 5-1 disc was far more degenerated than 4-5. The back pain, get rid of leg pain, get rid of weakness, numbness, and tingling. And all that's done through the procedure you just watched. Thanks for joining us. We'll be back with the SI joint.